Good morning, and thank you for joining us this morning. I want to thank Dr. Roberts and Columbus Public Health, as well as our Council President, Shannon Hardin, and all of City Council. At my State of the City address in February, I shared my equity agenda, an agenda that calls out racism and discrimination where it exists and our plans to address it. I also charged Dr. Roberts and her team at Columbus Public Health with determining how we would call out racism as a public health crisis and put together strategies to address it. A lot has changed since that night just 2 months ago, but what hasn't are the disparities that exist in our community, especially as it relates to health. COVID-19 didn't create the disparities, but it did shine a glaring light on them. In a few minutes, you'll hear from Dr. Roberts, who will give you the latest updates on COVID-19 and what we're seeing in Columbus. She will also tell you about the work that will occur through her newly launched Center for Public Health Innovation. But first, I want to reiterate my continued commitment to addressing disparities that existed before COVID-19. People of color are more likely to work jobs that pay hourly with little or no benefits, like in healthcare. If you don't work, you don't get paid. Work in critical frontline jobs that cannot be done remotely, as in healthcare, grocery, bus drivers, pharmacies, that rely on public transportation. When it is disrupted, they have more challenges getting to work. And those that live in housing with extended family, making it nearly impossible to isolate or quarantine when someone gets sick. Reduced access to quality education, unemployment or underemployment, living in substandard housing, higher rates of infant mortality, and the stressors associated with each of these are just some of the ways racism can impact physical and mental health. In addition, minorities are more likely to suffer from chronic health conditions like high blood pressure, heart disease, asthma, obesity. This is without a doubt the most challenging time most of us have ever faced. But together, we can tackle the crisis and the disparities in our community. I would now like to invite Council President Hardin to share a few words. President Hardin?
Thank you, Mayor, and thank you certainly to Dr. Roberts, and thank you really for your leadership during this coronavirus pandemic. On behalf of my council members, I'm glad to be with you this morning to discuss the health disparities that exist between African Americans and the community at large. I want to recognize the important work that Council's Health and Human Services Chair, Councilmember Priscilla Tyson, has been leading in this area, along with many other committed public health professionals. I keep a map of a 1936 lending map on my desk in my office. It's what we call the redlining map, and it shows how historical issues around racism have plagued communities and how they have a direct correlation to issues that we face today. Those issues vary from housing issues, those vary from safety issues, unemployment, but those issues are most seen in our health disparities. Disinvestment and lack of focus on health equity has created the disparities we see today, and those disparities underline the COVID-19 crisis. We know that locally, African Americans are overrepresented in the number of hospitalizations from the virus. Much of this can be attributed to pre-existing health issues that impact the Black community. This means that the impacts of COVID-19 will hit neighborhoods like the Near East Side and Southfield in different ways. Over the last several weeks, we've been talking to pastors, we've been talking to neighbors. They're concerned about their older church lady with asthma or their uncle who has diabetes. And we know this is not a Columbus phenomenon, but it's also a phenomenon that's happening all across the country. Every week I speak with council presidents from around the country. I've heard the same thing from council presidents of Detroit, Philadelphia, Charlotte, and many other cities. Racist policies from the past were not unique to Columbus. However, I believe by focusing on data and prioritizing investments in our communities, Columbus can change this narrative. That's why this council is so appreciative of the leadership of the mayor and his focus that will change the outcome. So I'd like to turn it over to Dr. Mysheika Roberts to tell us more.
Thank you, Mayor Ginther, and thank you, Council President Hardin. COVID-19 continues to sicken individuals in our community from less than 1 year of age to over 101 years of age every single day. We currently have over 1,000 cases of COVID-19 in Columbus and Worthington and have 14 deaths here in our community. 19% of our cases are healthcare workers, as well as we see that every age group can get COVID-19. We know that we have an increase of cases in ages between 20 and 29 years of age. While nobody, and I mean nobody, is immune from this infection in our community, its impact is particularly harsh in the African American community, as you've heard already. Right here in Central Ohio, African Americans represent about 29% of the population, but they represent 38% of those who are hospitalized with COVID-19 and 33% of those who need intensive care unit or a higher level of care while in the hospital. Persistent racial disparities and chronic diseases, as well as the social determinants of health that existed way before this pandemic started, are contributing to poor health outcomes for African Americans during this crisis. African Americans suffer disproportionately from diseases like diabetes, asthma, and lung disease, as well as hypertension and kidney disease. And they are more likely to die from these conditions even before COVID-19 occurred. African Americans' death rates from diseases like diabetes, hypertension, and chronic kidney disease is 2 times higher than it is for our white counterparts here in Central Ohio. These same health conditions put them at increased risk for complications from COVID-19. And while more African Americans deal with chronic disease that put them at greater risk for COVID-19, they are also less likely to have access to health care, and they need this health care to successfully manage these chronic conditions. For example, 13% of African Americans here in Central Ohio are uninsured. Compare that to 6% of Caucasians. Other barriers exist that prevent African Americans from improving their chronic conditions or preventing them in the very first place. These include a lack of healthy foods, limited transportation, high crime neighborhoods, lack of sidewalks, lighting, and green spaces in neighborhoods for safe physical activity further exacerbate their chronic conditions as well as their poor health outcomes. We also know that people of color are more likely to work on the front lines, such as service industry jobs like grocery clerks, bus drivers, and food workers, that make it very hard, if not impossible, to stay home, as well as practice that 6-foot distance that we talk about. These essential workers have a much greater risk of being exposed to the virus and spreading it to their loved ones because African Americans are more likely to live in dense areas and in multi-generational housing. And if African Americans are able to get a healthcare provider referral to get tested for COVID-19, they might find challenges with transportation to get to one of our drive-through testing facilities here in Columbus. So the bottom line here is racism and health disparities are a public health crisis, and one that has become even more apparent during this unprecedented pandemic. While Columbus Public Health continues to work with our partners on the front lines to battle COVID-19 in our community, we are also renewing our efforts and reinforcing our work to address racism as a public health issue. Columbus Public Health has opened a new Center for Public Health Innovation with a mission to increase life expectancy and raise the quality of life by reducing health inequities. In the coming months, we will examine factors that lead to Columbus's minority communities living shorter, less fulfilling lives, and recommend policies as well as interventions that deal with the immediate issue as well as the upstream causes. The new center will develop recommendations for Mayor Ginther to address racism as well as health disparities in Columbus to protect the health and improve the lives of all people in our community. While we continue to work to protect the health of African Americans during the COVID-19 pandemic, we will also strive to increase access to health care, improve educational opportunities, encourage job training, and promote safe and affordable housing, also known as the social determinants of health. When we address these things, we will improve the health outcomes not only of African Americans, but of our entire community during this COVID-19 crisis, as well as the days that lie ahead. Work by the Center for Public Health Innovation will be critical, very critical for our recovery from this pandemic and to helping set policies that will move us forward as a city for a healthier and more equitable community for all of our residents. Thank you so much, Mayor Ginther.
Thank you, Dr. Roberts. President Hardin, I want to remind everyone that we're addressing the COVID-19 crisis in 3 phases. First, the public health crisis, preservation of life. Human services, addressing the basic needs of our residents. And third, economic recovery. These don't start and stop neatly. In many respects, they are on parallel tracks. We're already in the midst, obviously, of a public health crisis, but the human service needs are great, that we're already receiving requests and serving those with the Community Shelter Board, with the Y, with the Middle Howard Food Bank, with Wellness and Life Care Alliance for Meals on Wheels. We know that equity must be the lens through which we address each stage of this crisis. Otherwise, the gaps that already exist will continue to grow. But as I've said before, with respect to racism, we need to call it out where it is and acknowledge it. We don't need to own the system or the history, but we do need to acknowledge that it exists. And as leaders, it is our responsibility to own the remedy. The disparities don't represent our values. They don't make us America's Opportunity City. America's Opportunity City is about resiliency, family stability, shared prosperity, and equity. And we are so happy that Dr. Roberts and the Stu Public Health Center for Innovation will help lead our work as part of the equity agenda. Because we know until we address these disparities and make sure that we are looking through the lens of equity, all of our neighborhoods and all of our families cannot reach their full potential. We'll now open it up to questions. Please come to the podium to ask questions. Dr. Roberts and I can see you, and obviously Council President, of course, is in chambers. I'd like to open it up for questions at this point.
Sean Lanier with NBC4. I know that this is kind of the COVID-19 pandemic has kind of hit us pretty hard and really quick. My question is, what are we doing now in these communities to try to help them through this process, to make it as simple and as easy as we can to promote healthy living during this time?
I'll allow Dr. Roberts to talk a little bit about what the department has been doing and is doing during the crisis. Dr. Roberts?
Sure. Thank you for that question, Sean. So we have Office of Chronic Disease Prevention as well as an Office of Health Equity. And so we've been working with our minority communities from both those offices as well as across the department for years, and working with community partners, our federally qualified health centers, trying to make sure people, one, have health insurance, but also making sure they have access to healthy foods. We do that a number of ways, from our community gardens that comes out of our office, as well as our WIC services that we provide. In the summer, every year, we've had farmers markets on our lawn at the health department. In addition to that, we partner with our county partners as well as our Health and Human Services Chair, Councilmember Tyson, on the community food plan that we work on. So in a variety of ways, we've been working with the minority community to try to get them to have access to healthcare, fresh fruits and vegetables, exercise. We work with our schools about safe rides to school, of how kids can safely walk to school, ride their bikes to school, and how they can get in that physical activity that's needed. Moving forward, we're going to do even more of that, and I would like to say on steroids. And those are some of the recommendations that we intend to provide to the mayor. During this COVID-19 pandemic, we've been working directly with communities of color, making sure that we provide information in a translated form in the language that they can read and interpret. We've also been partnering with the city's Department of Neighborhoods to work with our neighborhood leaders to get this information out to our minority communities about how they can protect themselves and stay healthy during this COVID-19 pandemic. So those are a few of the things we're doing and will continue to do even in the recovery phase.
The only thing I would add to your question, Sean, and I'm not sure if the Council President has any comments, is that the work that Dr. Roberts and the Health Department is leading is to start to think of racism and these health disparities based on the social determinants of health, not as separate initiatives or programs or parts of outreach, but truly the lens of equity that we do all of our work in the public health world, and really focusing on everything that we do at the health department, looking at it through the equity lens, because that's in large part what the equity agenda is for the city as a whole. And so Dr. Roberts launching this Center for Innovation is such a critical part of us implementing the equity agenda.
Oh, hey, Mark Kovac from the Columbus Dispatch. On this innovation center that you mentioned, can you maybe provide some more details? What kind of timeline are you looking at for recommendations? How quickly before you can implement some of these policy changes and things? Do you have a cost on what's this going to, how much is this going to cost? And obviously with coronavirus, the need is right now. So I'm just curious, again, on the greater timeline and how soon can you actually do something?
Well, thank you. So the center is using existing staff that we have at Columbus Public Health and refocusing their work on the work around racism as a public health issue. So in terms of cost, there are no new additional costs to the department or to the city at this point in time. In terms of the timeline, as the mayor stated in his State of the City, he asked for some recommendations by the end of this year, and we will make sure that he has them in advance of the end of the year. But as a result of the COVID-19 pandemic, we are seeing some things that we feel like might need to be addressed sooner. And so we are working on developing that list to get to the mayor, hopefully in the next few weeks. And so that as a community, we could start to act on some of these things immediately, potentially. But we will have definitely a comprehensive list to the mayor by the end of the year per his charge to me at the State of the City.
The only thing I would add, Mark, to your question is there will be additional resources. As you know, with the CARES Act and the Phase 3 of the stimulus, the city will be receiving some money for COVID response. And clearly, some of the work that in investments that we could make into this equity agenda, specifically responding to recommendations for the Center for Innovation, we potentially could use some of those resources, but other city resources as well. I can tell you this issue of disparities and making sure that every family can live up to their full potential in this community is a top priority for this administration. And I know that Council President Hardin and I have talked about it quite a bit, and his colleagues share those beliefs that until we address these disparities that exist in this community and communities, quite honestly, around the country, there's no way that we can meet our full potential. President Hardin, do you have any comments in addition to that?
Thank you, Mayor. I would just add to that, to your last point, that we don't see this as a one-off program or project. We see this as an ongoing commitment from the city that we will focus on disparities, we will focus on equity. And that's why we appreciated your leadership from the state of the city. But long before that, one of the things that you have said, if you don't track it, you don't mean it. And so this is the city's efforts to track the data and to look at the data, focus on the data, and to address those disparities.
Any other questions?
Sean Lanier again with NBC4. Just wanted to know, and Dr. Robertson, you and I have talked about this before, just with how certain neighborhoods are set up with, not a lot of fresh food options, not a lot of areas to exercise and things of that nature. Is the city doing anything now to address that? Because we're seeing that a lot of these nonprofits are not able to always feed the masses and the people who are kind of on that borderline of getting those fresh produce items to live a healthier life. Is that something that is kind of a high priority during this time and moving forward?
Absolutely. That's definitely a high priority now as well as moving forward. And the city has been partnering with Columbus City Schools to make sure that our kids who are not going to school every day but often get their meals at school can still have access to 2 meals a day. So we've been partnering with them and getting that information out, as well as our City Rec and Parks department is offering locations where people can get fresh vegetables, fresh fruits and vegetables. We've been partnering with Mid-Ohio Food Collective as well to work and increase our food pantry participation and access to food for our residents. And again, this is a partnership not only with public health, but with Department of Neighborhoods, as I mentioned, with Rec and Parks, and many other city agencies to get the message out, as well as the mayor's office to get the message out, whether it's social media and other media outlets, to let individuals know where they can access fresh fruits and vegetables and food in general, because we know so many in our community right now are suffering and need a meal. And so we are making that available to them through our partners and making sure they're aware of where they can access those food options.
The only other thing I would add, Sean, to your question is this is why sidewalks in our Celebrate One neighborhoods have been such a high priority, and a program that started by former Mayor Coleman, Operation Safe Walks, particularly around schools, senior centers, pools, places where children and seniors gather, but particularly in our opportunity neighborhoods have been such high priorities for the city for some time, is to making sure, one of the things we continue to stress is for people to get out and be active, get some fresh air during this crisis. And so some of the investments that we've made in our opportunity neighborhoods make that a little bit more available to the people of Columbus. Obviously practicing social distancing. We want to continue to follow the advice of Dr. Roberts and Dr. Acton, but that's why that infrastructure in our neighborhoods is such a top priority as well. This isn't just about health programs and initiatives, but again, that equity lens that we look at infrastructure, we look at programming, we look at investments that we're making into the quality of life of all of our neighborhoods, and that's why it's so important.
WBNS 10 TV. Both of you use the word racism, which is an emotionally charged word. I want to make clear that you're not suggesting that this is a deliberate act upon those members of our African American community, and people may be misunderstanding what you mean. Can you explain what you mean by that?
Well, I think we're being very clear about what we're saying. The Council President said earlier with respect to redlining, there have been decisions that have been made historically about where infrastructure goes, who's impacted by it, who receives lending, displacement of certain groups as the city has continued to grow and develop. There is no doubt about it. there is institutional racism, and there's racism everywhere in our community. And again, Kevin, the point is not that we need to own the history of racism, but as leaders in this community, particularly that are committed to an equity agenda, we have to acknowledge it exists. And clearly these health disparities that are now glaring before us with respect to the COVID-19 crisis, it would be reckless of us not to acknowledge what we see and what's happening to our neighbors in this community and around the country. Our job is to acknowledge that it exists and to own the remedy. And many of those remedies are going to come through the equity agenda that we talked about today, and specifically with respect to health out of Dr. Roberts' Center for Health Innovation. But racism exists. It exists in your newsrooms, it exists in the mayor's office, it exists everywhere in our community. We need to acknowledge that, and we need to own the remedy to address it.
Mayor, just the only thing that I would add to that is that the reason why it's important to focus on the racism and focus on the disparity is that you can't fix it unless you know the data, and that it's not just a black issue. To the mayor's point, if we make Columbus healthier, if we make Columbus African American population or address the facts of racism to the African American community, it actually makes all of Columbus healthier. And so this focus is not just on just making the African American community safer, or the black community safer. It's about making the entire Columbus community healthier. And that's what data will and the focus on and what this center will allow us to do is make Columbus healthier by focusing on the roots of racism and attacking the issue where it lies.
And I think to the council president's point, it's one of the reasons Dr. Roberts has been such a leader in making sure that this information about the disparities that exist get out there. And one of the reasons we continue to press, folks at other levels of government to share this information based on race, because to the council president's point, if you don't know it, if you don't share it, you don't acknowledge it, then the public doesn't understand the disparities that exist and why we need to address them. But Dr. Roberts, do you want to make any comments about the importance of that data, sharing that data, and why it's so critically important for the people to understand?
Absolutely. Thank you, Mayor. So I have really challenged my team from the beginning of this pandemic and even before this pandemic with other issues for us to highlight our racial data, whether it's for syphilis or whether it's for flu or whether it's for COVID-19. And it's important because, as Council President Hardin said, if you don't know the data, if you don't know what you're seeing, then you don't know how to intervene. You don't know how to assist and where to deploy those resources. So I think it's vitally important, no matter what health issue we're talking about, that we have our health, our race and ethnicity data to guide us and provide the right interventions to the right community. And as we've learned, particularly with infant mortality, for example, we know that certain communities need a little more assistance than others, and that's okay. That's okay to provide that equity. It's not always equality, it's about equity. And so I think with the pandemic, with COVID-19, we've seen the disparities are not just because of someone's skin color, but it's because of the underlying health conditions that existed before the pandemic that are putting them at increased risk for complications with this virus. And so it's not just about, testing more African Americans to see if they have COVID-19. That would be helpful as well. But it's about addressing those underlying issues like the chronic conditions and what we can do to prevent them or better treat them. So the next time we have a virus like COVID-19, we won't see the same impact with our communities of color.
And I guess the only other point I would make, Kevin, to your point, I disagree to a certain extent with the premise of the question that this is emotionally charged. These are facts. And the more data and the more facts and the evidence that are out there, the easier it will be for the public here in this community and around the country to acknowledge the reality of what racism has done to this community and communities around the country, and the prevalence of those decisions in health disparities. And so the more we know, the more evidence we have, the more data, the more informed our decision making can be about equity, because equity is different from equality, to Dr. Roberts' point. And the equity agenda is focused on calling out these disparities and making investments so that we can realize equity in our community. Any other questions? Well, if there aren't any other questions, I want to again thank Dr. Roberts for joining us today. Council President Hardin will be doing more of these in the weeks ahead to give the public and the press the ability to ask us questions as we can continue to battle COVID-19 here in our community. I want to thank the people of Columbus again. It has been remarkable, the compliance and engagement that this community has shown with our stay-at-home orders. There is no doubt about it. It has made a huge impact in slowing the spread and flattening the curve, and I'm grateful to the people of Columbus. I'm grateful to Dr. Amy Acton and Dr. Mysheika Roberts for being incredible public health advocates and for speaking truth to power, to continuing to help us deal with this crisis, remaining focused on the health and safety of our neighbors. I also want to thank all of our great partners in the community, whether it's our healthcare systems or incredible partners like Battelle and Cardinal Health and Abbott Labs that have been on the cutting edge of innovation to support this community. And then our incredible partners, whether it's Meals on Wheels, the Community Shelter Board, the YMCA, all of those that we're working with to help to address the humongous, just huge human service needs that are already present in our community based on loss of jobs, economic displacement. So I just want to say thank you to all of those incredible partners and look forward to talking with you again in the days and weeks ahead. Thanks for joining us.